Hi, Dr. Nagy here from Oakwood Dental, and we oftentimes get questions from parents about space maintainers. When do we use those, and what are they used for? So, space maintainers basically hold a space if there's early loss of a tooth, or for example, if a child lost a tooth too early because of an accident or whatever reason there may be, the space maintainers will hold that space where the baby tooth was, so the permanent teeth will have enough room to come in. Now, there are two kinds of space maintainers. There are these small single tooth space maintainers that we use less often. These are the benefit of them that you can very nicely hold a space for one tooth. The problem with these smaller space maintainers is that once a baby tooth falls out in front of them, they no longer work because there's no more support for them. There's also these two-sided space maintainers called bilateral space maintainers. The nice thing with these space maintainers is that even if a baby teeth fall out in front of these molars, these space maintainers will still work because they're being supported in a larger area. And again, the point of these space maintainers is that if a baby tooth falls out here, they will hold these molars back and they will make a child less crowded, so there will be more room for the adult permanent teeth to come in. Now, the space maintainers can be placed on both upper or the lower arch. Here's an example of an upper arch space maintainer. It holds these molars back by having a support for them, and then it has two arms to hold both of the molars. It could be a single-sided too, so you can have two sides or a single side. These both-sided space maintainers are nice because they have a nice support for them, and if some of the baby teeth fall out, they will still work because they're being supported up here in the front of the roof of the mouth. There's a space maintainer that goes on a lower arch, and these again can be single-sided or both-sided like here. And again, the benefit here is that they will hold these molars back, and if the baby teeth fall out, they will preserve this space where the adult teeth will erupt into. Now, if you look at an example, so here's a child, for example, who's got quite a bit of crowding, and these lower permanent teeth have a hard time coming in because there's low space. So if you place a space maintainer, that will preserve the space because the baby teeth are larger than the permanent teeth. So normally these molars will simply drift forward, and the space maintainers will hold these molars back, so there will be more room for these adult teeth to come in. And here's an example of such a space maintainer here, and a few months later, once the baby teeth have fallen out, you can tell that the permanent teeth that you can see here are very nicely erupted. Now, it's very important to brush and clean around these space maintainers, and I would recommend getting an electric toothbrush and a water pick, but you can tell how nicely they work in these cases. Now, if you look at the comparisons, you can tell what happened here. And these space maintainers can be left in place for several months or even several years, depending when a child might have lost some baby teeth early on, or if they have a lot of crowding. Now, with single tooth space maintainers that I showed you, like for example, here is one that it only holds the space for one tooth. The disadvantage with these space maintainers is that once the baby tooth in front of them fall out, these space maintainers no longer work because there's nothing supporting them. So when you have these larger space maintainers, they're supported even if the baby teeth have fallen out because they have this arm that wraps around the front teeth, but that's not the case with these single-sided space maintainers. So it's very important that if your child has one of these small space maintainers, that you have them checked, because once the baby teeth have fallen out, see, as you can tell here, these adult teeth are freely drifting forward, and they would make the child more crowded. So it's very important to once we get to this point, that we come up with a new plan of how to hold these molars back to reduce crowding, and we create more space for the adult teeth to come in. So hopefully this answers your questions about space maintainers, and if you have any other questions, you're always welcome to ask us at the office or give us a call. And thank you for watching, and have a good rest of the day. Bye.